cardiovascular values in different types of shock. The four big categories of shock are listed here. Let's start with cardiogenic shock, which is failure of the heart that leads to low cardiac output and high systemic vascular resistance. The failure of the heart can be due to cardiomyopathy, arrhythmia, or valvular dysfunction. And in response, you have a low cardiac output, a high systemic vascular resistance, and you also have a high preload. Your perfusion in this case would be low. In distributive shock, like septic shock, you have peripheral vasodilation, often due to infection and cytokine release. This leads to peripheral vasodilation, which is a low systemic vascular resistance and a high cardiac output in response. That high cardiac output is in the early stages. In the late stages, it might drop. This is the only one that has a normal or high perfusion of oxygen in the veins. Hypovolemic shock is low intravascular volume, which leads to low cardiac output and high systemic vascular resistance in response. And lastly, obstructive shock is an extracardiac cause like pulmonary embolism, tamponade, or pneumothorax that obstructs the forward flow of blood, leading to low left ventricular cardiac output.